RadioNOW 100.9's Indy Connection with Emily Metheny.
Hello, I'm Emily Metheny, your host. This week, I had the opportunity to talk with Dr. Lana Dbeibo, an infectious disease physician with Indiana University Health. She explained how vaccines work, how companies were able to get so many into trials quickly, and much more to help people better understand the science behind vaccines.
So a vaccine is basically a medication that someone gives or gets so that they can develop immunity against a certain infection. This is not a treatment type of medication. This is a preventative type of medication, usually where the drug has usually a component of the vaccine a component of the infectious agent that is able to get into the body and produce an immune response against that particular infection without usually causing the infection itself. So usually it's either a part of the infectious organism or a very, very, very weak and attenuated form of the organism. In both cases, they are not able to cause the illness itself, but they are able to get into the body. And once the immune system recognizes them as something that they're not used to, the immune system will start developing an antibody and a strong immune system against them. And that will stay with us. And once we are exposed to that infectious agent in the community, then our body will remember the immune response and will start producing more and more antibodies so that they can help prevent us from getting severely ill.
Okay. And so specifically with the COVID-19 vaccine that's come out, why is it in 2 doses?
So that's a great question. This the dosing of the vaccine is important to give us a strong immune response that will last long. And many vaccines require a booster dose to make sure that you have enough immunity that will last a long time. So it's both to give us appropriate immunity and so that it can last long enough.
And do you think in the future that we might have to get a booster again beyond the 2 doses currently?
It is possible, yes. So in some cases, one vaccine may be enough to last a lifetime, but there might be a situation here where the immunity will last for just a few months, a year, 2 years, and then we would just need a booster dose or reminder dose so that we can keep our body our immune system in a way that it will remember that infectious agent once it's bombarded with it again.
Okay. And then recently we've been seeing that there's a different strain in the UK and it's now come to the US. Will the vaccine be able to protect us from mutated strains like that?
So the vaccine will be able to protect us against this particular mutated vaccine. That's what the data so far is showing. But it's not a guarantee that it will protect us from future mutations as they happen. So it is possible that we might end up in a situation as this virus keeps propagating in the community that the mutation will not be targeted by the vaccine. And that would be an indication for adjustments in the vaccination that we are getting. So they may need to be modified with time. That's actually what happens with the flu vaccine, is that every year we change the type of vaccine based on the type of the mutated or different type of the, I shouldn't say mutated, the different type of the flu vaccine that is circulating in the community at that particular time.
Okay. So as things are going, it could be kind of like the flu shot where as we learn more, we adjust and we're able to better protect ourselves.
Absolutely, yes.
And so kind of on that train of thought, with research isn't going to stop just because we have the 2 vaccines out right now, right?
Right. So this is a continuous assessment process that we're going to have to keep doing. And that doesn't mean that the vaccination we will have to start all over again with the studies. If the vaccine mutates or if the virus mutates, then the vaccine can be adjusted to accommodate those mutations. Yes, we will continue to assess the efficacy of the vaccine against new strains in the next following months and years. And we will also continue to make sure we monitor the side effects profile of that vaccine over time, which I know is an active process by the CDC.
Excellent. And for people who've already had COVID, do they need to get the vaccine, or do they have an immunity from fighting it before?
So now we know that people who have had COVID before will continue to be in kind of an immune state for the next 3 months post their infection. However, the immunity based on some studies that is provided by the infection is not as reliable, meaning that it might be different between two different people as far as how strong it is. Therefore, having a previous COVID infection does not mean you shouldn't be getting the vaccine. So we would still recommend that people who have developed the infection still get the vaccine, because it gives them a more reliable level of immune response that we know has been studied to prevent you from getting infection or from getting reinfected. However, because of the supply limitations, I think Indiana and the CDC is saying it's okay for people who have had COVID to wait for 3 months to allow other people who have never seen COVID and their bodies are not have not developed any immune response to COVID, to allow those individuals to be vaccinated first. But there is definitely no medical problem with them getting the vaccine now.
And how did we find that the immunity from having it is different than having the vaccines? I wouldn't say immunity, but having that response already. Like how are those different?
So there is data that the antibody response is stronger in those who are vaccinated than those who've had the infection naturally, and that's based on the studies that were done.
Okay.
Whether that translates into longer protection from the vaccine versus normal infection, we don't know that yet, but we do know that the level of antibodies were higher in those who had the vaccine than those who had the infection naturally. So, yep.
Okay. I was just curious.
Yep.
And then when it comes to prioritizing the vaccination, you've mentioned that people who've already had it potentially wait a little longer to get the vaccine because they've already had it. Who else should be next in the prioritizing of the vaccine distribution?
So currently in Indiana, apart from healthcare workers, so they started with healthcare workers because they wanted to support the infrastructures to make sure that there is enough people that are available to take care of all the sick people that are developing COVID. So as you know, hospitals are strained, healthcare workers are getting sick and are not able to staff these hospitals as well as we would like. And as we give them the vaccine, we'll be able to make sure that we at least have a good infrastructure to take care of the sick, whether because of COVID or because of other reasons. And then long-term care facility residents, because there is a lot of death in that population from the experience in Indiana and other states. The next stage is an age-based approach to prioritization. As you all know, the older age you are, the higher risk that you will have of death and complications from COVID. So that strategy is helping make sure that the most vulnerable are safe from this illness. So that's how the next level of priority is. We're working right now in Indiana through 80 plus, followed by 70 plus, followed by 60 plus years of age because of that particular reason.
And if people want to follow and get the most up-to-date information on who's priority, who could be next, all of that, where can people follow along and get the most accurate and up-to-date information?
The most up-to-date information you can get about the specific prioritization for Indiana is on the Indiana State Department of Health website. This is where all their information is updated and it's available to the public to see that. Obviously, medical providers and healthcare systems also update this information on their own website. So this is another reliable source of information that you can get about this.
And then if I want to start the conversation with a family member who's like, no, I'm not going to get the vaccine, I'm really worried about it, how do you start that conversation to help them understand the importance of getting the vaccine and help them find reliable information? How do you start that conversation?
Great question. So I think the first thing is I'd like to listen and try to understand what their fears are. That's what I do with all of my patients who ask me about vaccine, is understand what's worrying them and try to address those worries with them. I think talking to healthcare providers will allow them to feel more potentially safe and secure. So I think reaching out to people that you trust will give you reliable sources of information that you can trust is going to be very important. I think I always reach out to science when I answer questions about why people are worried about getting the vaccine, because I want to make sure I give them reliable information. And I also tell them what we know and what we don't know, because I think that helps establish the trust between me and the patients, is making sure that, I tell them what we don't know, not just what we know. So reliable sources of information are very important. As you know, right now, all kinds of information is getting disseminated about vaccine, and it's very hard for people to know what's true and what's not. So going to medical scientific websites, your CDC, your Indiana State Department of Health will give you the most up-to-date information on the data, as well as your primary care physician or trusted physician offices, as well as your healthcare systems communications websites. These are all good sources of information that you can rely on, not giving you a false information.
Excellent. And after people get the vaccine, do they still need to follow the social distancing and safety precautions that are already in place?
Yes. So everyone who is vaccinated, what we know right now is everyone who's vaccinated will be protected themselves against developing severe COVID disease. What we don't know yet is whether they would be able to acquire the disease asymptomatically and still spread it. So you have enough immunity to not make you sick, but you might still get it and transmit it to others. Mm-hmm. So until we have that information, we cannot yet rely on just the vaccine to stop the CDC measures of masking and physically distancing. So definitely the vaccine is important because it prevents you from getting ill and dying. But we don't know yet if it will prevent you from transmitting to others asymptomatically. We hope that that's the case, but we're waiting on information before we can give a definite on that.
And then we've touched on it already. We're still studying and we're still learning about COVID-19. Do you ever think we will get all the answers or most of the answers about this disease?
Absolutely. I think eventually we will learn everything that we need to learn about this vaccine so that about this disease, so we can have the best ways and tools to overcome it and get over this pandemic. I think what we lack right now is time, because many of those studies require us to monitor things over time to see For example, how long does immunity last? How many reinfections can you get, and when do they happen? This all will depend on time, but it doesn't mean that we will not be getting the answers, because I know research is ongoing on multiple fields in COVID-19, and we will be able to get answers on almost most of our questions.
And kind of touching on time, how are we able to develop multiple vaccines and get into trials so quickly with COVID-19?
Yes, I think that's one of the most common questions that people who are hesitant about the vaccine ask is how is it that we spent so many years developing vaccines for Ebola or Zika and then so fast for COVID-19? And there's multiple reasons for that. One, the technology for many of these viruses has already vaccines has already been established. So mRNA vaccines have been studied for a decade almost. Adenovirus vaccines have been as well. And obviously protein-based vaccines that are currently in development, we've already used that technology in flu vaccines and others. So the technology is not new. So we are building on previous technological advancements that we've had. But when you add to that all of the resources available, all many pharmaceutical companies are pouring a lot of time, money, and energy into developing this one thing. Usually when resources come together, things happen. The other thing is, people were excited about enrolling in clinical trials. Usually it takes many, many years for us to get people to join clinical trials. But in this one, because people wanted to help and end this pandemic, we saw a lot of acceptability to join clinical trials, and that is super helpful to help us move faster on those studies. The last thing is the fact that we are currently in a pandemic, so the rate of disease is really, really high, and that allows us to be able to study the efficacy of a certain vaccine versus not getting the vaccine very fast. If it was a very rare disease, it would take us years to establish efficacy data, just because it takes so much longer to be able to build enough cases to establish efficacy. Versus now, we are in the middle of pandemic, and it's very fast. Very fast results can happen.
Thank you, Dr. Dbeibo. Is there anything else you'd like to add before we wrap up?
That's it. I think I would just say, get vaccinated. I've gotten the vaccine myself. I did not have any major side effects. So always think that the side effects that you get from COVID vaccine, so from COVID as an illness, is much, much higher and maybe much long-term, as we already know from scientific data, than we know anything about severe risk factor, severe side effects from the COVID vaccine. So I would encourage people, talk to your doctors, and as we are getting vaccinated, please continue to observe physical distancing and mask wearing. The numbers of cases is really going up very fast. Deaths are going up, hospitalizations are going up. So we really need to stay the course here. And I know people are tired, but we really need to follow guidelines so that this doesn't get more out of hand than it already is, especially with the new mutant strains.
Excellent. Thank you so much.
Thank you.
To learn more about vaccines and stay up to date with everything coronavirus related, you can check out the Centers for Disease Control and Prevention website at cdc.gov. You can also check out the State Department of Health at coronavirus.in.gov. Thank you for joining us this week, and please join us again next week as we talk with Ashley Haynes from Keep Indianapolis Beautiful. We're going to talk about ways to stay active during the winter and Art and Seek. If you have any questions or topics you would like me to cover, please email me at emetheny, that's EMETHENY, at radio-one.com. You can also message me on Twitter at EmilyDoesVideo. Until then, have a great week.
Radio Now 100.9's Indy Connection with Emily Metheny.